guys, it's Nikita Lene. Today's video is about how to prepare for the NCLEX from day one of nursing school. Now, if you're in nursing school, you're a nursing student, or you've been thinking about starting nursing school, this video is for you. These are going to be some tips and tricks to really help you start to mentally and physically prepare yourself for the NCLEX way before it's time to actually take the exam. So if you're interested, stay tuned. Tip number one is understanding the NCLEX. The NCLEX is a cumulative exam. It's going to test you on everything that you've learned throughout your time in nursing school, which means there's going to be different topics that are going to be covered. Understanding and knowing this means that as you gain knowledge, you're really going to have to hone in on your weak areas and your strengths and knowing what they are to prepare for this test that's going to go over everything. Now, understanding the NCLEX also means understanding how the exam works and the type of questions that you can expect on that exam. As you progress through nursing school, you're going to start to experience these different types of questions. For example, there are select all that apply questions. Those are known to be the hardest questions that you can possibly get on the NCLEX. However, the more you practice these types of questions and make yourself familiar with how to answer them, the easier it's going to be when you sit down for that exam. Understanding the NCLEX also means staying abreast on different changes to the exam. For example, we were notified that shortly after we take it, there are going to be additional changes made to the styles of questions. This can include drag and drop answers. The best way to do that is to keep up to date with information. When your instructors let you know that there are going to be changes and things to stay ahead of, make note of those changes, because the best way to prepare yourself is to do your research and to practice ahead of time. Tip number two is use all of your resources and senses to study. And what do I mean by this? This includes using multiple sources to study. Now, there are a lot of students who just read from the book and do very well, but the best way to study for nursing school exams and for the NCLEX are going to be to use multiple resources. Those different resources can include your ATI book, your textbook. There are a lot of YouTubers who make some phenomenal videos breaking down different topics and information, using an NCLEX prep book, wherever you can get the information, accurate information that is. You want to make sure that you use different resources because they're going to explain information in different ways, making it a little bit easier for you to understand. They may break down the information or just explain it better in a format that's easier for you to understand. Once I was able to change my study style and include all of my senses, I definitely saw my test scores improve. So I started to read the book, I would write my notes, and then I would listen to podcasts, watch YouTube videos, go back over my notes. Sometimes I would highlight the most important things, or maybe even the items that I was having a hard time remembering. And the funny thing is even when I would take an exam, sometimes I could close my eyes and remember reading that sentence over again that was highlighted, or that lab value that I remembered listening to in a YouTube video and someone repeated it several times. So just using all of my senses was really, really helpful in information recall for me. Tip number three, stay organized. So as I mentioned earlier, the NCLEX is a cumulative exam. So they're going to pull out some questions from way back in fundamentals of nursing. And for my new nursing students, you're like, oh, that was just a couple weeks ago. But once you get towards the end of nursing school, you're going to be like, oh my gosh, I forgot I even learned this. So the best thing you can do for yourself is to keep all of your information, all of your notes, everything organized, and to keep everything labeled. This is going to help you when you get to the end of your program and you have to go back over something that seems to be like minute. You just need to refresh your memory on it, but you can't seem to find your notes. The last thing you want to have to do is to pull out your fundamentals book and have to dig through it to find information. If you have all of your notes organized, it'll really make it easy for you to reference one or two topics, for you to refresh your memory, and to not have to repeat work of rewriting notes once you get to the end. Nobody wants to have to do that. A couple of different ideas for how to organize your information is to possibly keep a binder for each one of your courses. And at the end of that course, you can pull out the pertinent information that you need, or you can even keep it in that binder and keep it separated by disease process. I kept a specific area in my notes where I had all of my procedures, all of my lab values, and that really helped so I can go back and reference. You'll also probably want to do that for things like vitals, because once you get to peds and you have a whole different set of vitals for kids versus adults, it's going to be hard to kind of keep that straight in your mind. You're going to want to be able to go straight back to a specific area and say, here are all the vitals for all age groups, and they're separated by age group. These are all the lab values for different age groups. If you have it separated like that, it's just so much easier to reference. So those are just a couple of ways for you to separate your information. Tip number 4, practice, practice, practice. Practice makes perfect, and although no one's perfect when it comes to nursing school, you can get as close to as perfect as possible, right? So as you go through nursing school, you're going to have so many practice questions along the way, and you're going to have a lot of exams and things like that. Those are all great ways to practice NCLEX style questions. When it comes to studying the material, it's really up to you individually to find additional resources, and practice questions are a great resource. Now, the thing that I found over time with practice questions is it really doesn't help if you just do the question and then say, okay, I got this right, I got this wrong, and memorize the right answer. What you'll find over time with nursing school is that a lot of the questions are going to seem like repeats. Now, either the question will be identical to one you've already seen before, or it will be similar. So the best way to break down those questions and really set yourself up for success is to look at the rationales. Now, going through each rationale, you'll have to look at why you got the right answer right and why you got the wrong answers wrong. Reading through each rationale and taking notes on it is really going to help to prepare you for the next time you see a question that may be similar or even identical. Additionally, when it comes to practice, you have to understand that if you don't use the information, you will lose it. And like I mentioned earlier, it's going to be really hard to pull some things from fundamentals back to the forefront of your memory if you have not used them. Some of the best ways that I found to keep refreshing information is understanding your weaknesses and some of the areas that you need to brush up on. I kept a sheet on my cork board at my desk, so it was posted right in front of me every time I studied. And if there was a concept that I felt I was weak in, I had a hard time memorizing it, or I didn't understand that concept, I would write it down. I made sure that I came back and restudied that information later, and then at the end of the semester, I would take that sheet and I would keep it in my study binder. Now, in my study binder, I had accumulated a bunch of topics that I felt like I needed to continually refresh my memory on. One of those is labs. Labs are really hard to remember, and you're going to find yourself really questioning, like, I knew what normal potassium level was 2 months ago, and it kind of slipped my mind now. Don't beat yourself up. This is completely normal, especially once you start to go through classes like your public health class or you get to pediatrics. Memorizing or remembering things from months ago is going to be a little bit harder. So keeping those things close in some type of reference format where you can look at them consistently, either on if you can't do it on a daily basis, at least do it once a week. Just look through that information, refresh your memory, whatever format you need to do that in. That could be a small notebook that you keep in your pocket when you go to clinicals. That could be making like a Quizlet flashcard set, or you can even make physical flashcards if you prefer those, and stick them in your pocket or stick them in your bag. Just something that you can reference often so that you keep that information close to you and you can consistently go over it and practice it. That way it will allow your brain time to memorize those things, because honestly, while you're in nursing school, you're shoving so much information in your brain that some of it just gets put in short-term memory, and you're going to need it in your longer-term memory. So making sure that you go over it consistently over time is the best way to stick it in your long-term memory, and that way you'll have it available to you when it comes to the NCLEX. Tip number 5, hold yourself accountable. When it comes to nursing school, it's really easy to get into this herd mentality where you're used to studying in groups and you're used to, your normal posse or your clique that you hang out with. But at the end of the day, everything about nursing school and everything about nursing is going to be really focused on you. You really, really have to put in the work and put in the time to get past these hurdles. As time progresses in nursing school, you'll realize that there's a lot of times that you don't feel like doing the work. You're going to be tired. That's just me being 100% honest. You're going to be tired and you're not going to want to study at times, but you really have to hold yourself accountable, and you really have to be honest with yourself about what are my weaknesses? What are the areas I really need to study harder in? What are the concepts that I'm just really not getting? And you have to go out and seek the resources that you need to get over that hump. So for example, if you know that diabetes is a concept that you do not understand, if you brush past it in fundamentals, I promise you it will come back to haunt you again later. A lot of these concepts are going to repeat. You're going to see them again in peds. You're going to see them again in women's health. When you get to OB, you will see them again and again and again. And as you get further along in your program, these concepts are only going to get a little bit harder because you're going to have to apply them in different scenarios and situations. So holding yourself accountable and knowing where your weaknesses are, you really have to find the time to hone in on those things, to find the resources you need, and to really study so that you have an understanding. Having a basic knowledge on some of these topics may help you get through one class, and you may find that it works and you're able to kind of slide by with just very basic information or just guessing even. But I promise you it will come back to haunt you later on. So you really have to hold yourself accountable, because you don't want to get to the end of nursing school and realize like, I'm really not prepared for the NCLEX, and I'm not prepared because I've kind of half-assed my way through it, or I've been able to to get away with barely understanding these concepts and this information, and it's going to be that much harder for you to get through the NCLEX. So really do yourself a favor and really hone in on those topics and areas where you know that you are weak. Write them down, hold yourself accountable, break those concepts down into smaller topics and smaller chunks to study, and look them up in multiple resources, maybe in an NCLEX study guide. You can go over the notes there, finding a YouTube video that will go over it in more depth. Or even if you have a study group, you may have a friend that maybe is stronger in that topic than you are. Ask your friend, hey, can you explain this disease process to me? Because I'm just not understanding how it affects the body, or I'm not understanding why we need these medications for this disease. But don't be afraid to ask for help. Don't be afraid to hold yourself accountable and to really get in there and dig deep and study, because it will help you out in the end. It will help you even further beyond the NCLEX. Having that mindset of I need to do more and learn more is going to help you as a nurse in general, because once it's you one-on-one with that patient, no one's going to tell you, hey, you need to understand why your patient has a fever. You need to understand why we're giving this medication. You really have to learn that independence as a nurse and understand that it's not just about exams today, it's about your patient's life tomorrow.